Hello and welcome to another episode of Core Balance Coaching, where we get together once a week to talk about a different topic related to getting out of the back pain cycle for good. My name is Dr. Ryan Peebles, and I've dedicated the last 20 years of my life to better understanding and reversing the root causes of chronic lower back pain. This week's topic is chronic lower back muscle tightness or tension, and it was definitely inspired by some student conversation and questions over the week in the Student Hub. So that's how we like to do it most of the time. So I'm excited to get into this one. It's going to be a little bit of a continued conversation from last week's stream. And I've put some thought into this one, how I wanted to structure the presentation. And I had all these great ideas, and I was going to show some of my journal entries from back in the day, like 15 years ago, when I was dealing with this problem, and I would write about it. And I had some technical stuff come up, and so I'm going to share that stuff in a different stream. I'm going to share my story and all that. And this week, I'm just going to get down into the nitty gritty. We're going to talk about basically, how's my volume? I am seeing that it might be a little high, but let me know if I sound good. This week, I'm going to we're going to talk about the factors that are contributing to the problem, possible factors, so to try and better understand the problem. And then we're going to go into short-term methods for relief, and then we're going to talk about the contrast between those methods and techniques versus long-term strategies for addressing the problem. And you'll see that the long-term strategies will all relate to these factors, each of these three factors that we're going to talk about as a possible causal factor, kind of a contributing factor. And I say possible because everybody's situation is different. And the one thing that I want you to know before we get into this is that there is no one single obvious, like, that's it, that's the cause, and this is the clear, obvious solution that you have to do, and you're going to be free of it. Like most things in life, most complicated struggles or not complicated. It doesn't have to be complicated. It can be simple, but most ongoing struggles that people face in life, there's multiple factors going on, and it can be vary from person to person. And so we're going to talk about each one, and some may be more relevant to you. And then we'll talk about these short-term methods that can be very beneficial, and they can actually help be a catalyst in your healing process. But alone, they are not going to be the solution. And then we will go into the long-term strategies for addressing each of these three causal factors. So I'm excited to get into it. I see a bunch of people here and some action in the chat, so welcome everybody. Thank you for showing up live. And I'm just going to take a quick look at the chat just to make sure I didn't miss any questions. Good to see some familiar names in the chat. Chris, Tsipora, Kevin, yep, you're featured in one of the questions. Jesse, welcome. And looks like there's no questions except one question from Marina. So hopefully, there's Marina. Hello, everybody. All right. So why don't I start with this? I wasn't planning on this, but I do want to just share that this was inspired by a student post. I believe it was this one here. So this is from Troy. I don't know if Troy is here live, but he had a great question from last week, and I answered to the best of my ability. And then he responded. So why don't we just read this and then we'll get into the topic. So Troy says, your YouTube video explanation of the contracted para-spinals. So that's I don't know, kind of a umbrella term for all the lower back muscles that parallel the spine. Causing my L5-S1 to compress and cause pain was a game changer for me. I've begun to constantly check and see if the paraspinals are relaxed or contracted throughout the day, and it's amazing how many times I reach around and feel the two columns along the spine being super tense, contracted, and sometimes even rock hard. I had no idea it was like this all the time. So this is the situation for many of us, and it was certainly the situation for me. I don't know if you saw the cover image for this live stream, but that was a picture of my back, probably around 2010, and you could bounce a quarter off of my paraspinal, my lower back muscles. They were exactly as Troy is describing. He talks about how his wife. He checked her muscles and they were nice and calm, and his were rock hard. So here's the question. How do I get these muscles to just relax? What in the heck am I doing wrong while just living my life? I know the wall sit gets them to release, but I can't go through the day sitting against a wall, right? This is frustrating and concerning, but I'm hopeful. Thanks for the tips and advice. And then we see, Kevin and Jessica Nelson, you guys are here live. So we have a bunch of people that probably feel they can relate to this. And I think that it's just reaches far beyond the people in this program. This is one of the most common issues that people might face with lower back pain. So we're going to go to, let's get right into it. Go here. So factors that could potentially be causing chronic lower back muscle tension. The first thing I have written down is protection, and I put a star next to it. And the reason is because I believe it's the most significant factor. And it's also the most complicated. So I'm going to actually save to talk about this one after these next two. So we're going to talk about that one after compensation. So let's talk about pattern first. We are all living in this system, this biological computer where we have software programs, and we are running on these programs, and we have default patterns. They're called movement patterns. They're postural patterns. They're just the way that we have the grooves that we have formed through repetition over time. And so it may just be a pattern that we're stuck in. The chronic lower back muscles may have tightened up originally for a different reason, but over time, after years and years and years of being this way, it's become the default pattern of the way that they live and the way that our body operates. So this is the hardest thing to probably break out of, is the pattern. And it's, I believe, one of the biggest challenges for students in the program. It's the main thing that we try to address in the program. It's probably also what kind of separates core balance training from a lot of other just exercise-based programs where you're using exercise as the solution, as the treatment. We're not trying to do that. We're trying to use exercises as a way to learn more about how to use our body. And the ultimate goal is to break out of an old pattern and form a new healthy movement pattern. So we're going to talk more about that in the long-term solution. Let's talk about, so we got that down, movement pattern. The third one is compensation. And so regardless of it being a pattern, these lower back muscles may be compensating for other muscles that are no longer doing the job that they were originally designed to do. I could pinpoint a couple muscle groups. One will be the core muscles, the abdominals, the deeper abdominals, and the glutes, and also the deeper hip muscles. If these muscles aren't doing their job, then other muscles are going to have to do more work. And so it's kind of the opposite of reciprocal inhibition, which we're going to talk about later. But when muscles are inhibited, other muscles have to step it up. And this is part of the pattern, but even if you were to break out of the pattern, or, there is a little bit of a difference here in that compensation can occur with no pattern. Maybe it's a short-term compensation. Maybe you had a traumatic injury to your abdominal muscle group, like I experienced in college where I tore my abdominals. That I was not in a movement pattern of abdominals. Well, I may have been, but it was the injury that caused more of a compensation, and my lower back muscles really had to fire up extra to do the same things in life. So the lower back muscles could potentially be compensating. Now let's go to the most interesting one. So protection. We know, and I could review, but I hope and believe that everyone here has watched the masterclass. We know about muscle imbalances and that there is a predictable pattern of imbalances that occur, and traditionally this is a response. I say traditionally, typically it's a response to a protective response of the body to bring the body into the fetal position, the position of protection. And part of that, that pattern, and let's see if I could just find an image here. This is the pattern, and if you continue to fold this person up in this crossed posture pattern, he will fold up into the fetal position. Those hip flexors bringing the hips up, the neck coming forward, and we don't actually. We resist. We don't actually go into the fetal position. We still continue to stand up and go about our day, but these muscles are still attempting to do this on a subconscious level because of potentially either injury to the tissues, injury to the lower back tissues, or this is where it gets really complicated. And the reason for the asterisk is it doesn't actually have to be an actual injury. It could be perceived injury. It could be perceived danger. It can be fear, where there is no actual injury, active injury occurring anymore. Maybe it was a past injury. Maybe it was a past trauma that has healed up to the level that it's going to heal. But there is still perceived injury, and pain is something that is created in the brain. We have done a stream on pain, one of the very early streams, and is highly, highly subjective. It's the most subjective thing about all of this. So the lower back muscles, to come back to the slide, may be protecting an actual injury, so they're tightening up like a brace. If you injure any part of your body, the typical inflammation response is that the muscles around that injury or that joint will tense up to protect. Or it may not be a current relevant injury. It may just be that it is a continued there's words in the medical industry like central sensitization, a continued reaction of the nerves and the brain to be protecting something that may not actually be there. And that's possible. So that's the reason I'm talking about it here today, is that the lower back muscles may be in a chronically tightened state because of something that's going on more up here than actual physical stuff going on in the body. So that's as far as I want to go into these three topics. If there's any questions, I'll take a quick look into the chat. So looks like Amanda has a question. Curious, what are your thoughts on using M-Sculpt to give a little extra help in strengthening the deep abdominal and glutes? So great question, Amanda. I don't know M-Sculpt, but I will come back to that since it's not on topic with the stream. I'm going to come back to that, and I might even look it up on the stream and see if I can get an idea of what that is. Diane, I agree, protection is a big factor. So no question here. Okay, cool. All right, so let's go into solutions. This is probably what everybody really wants to hear, but I do believe it's very important to get a good understanding of what could be contributing to the problem, and maybe one or more of these factors you identify with more than the others. So short-term methods, and I don't want these causes to get lost in the short-term methods, because the short-term methods have really almost nothing to do with these actual causal factors. The long-term strategies, we're gonna address each of the factors, but we have to talk about the short-term because it's what people do, it's what a lot of the focus is on, and it's also highly accessible. You can do most of these today if you wanted. They're quick and they're easy, and they do offer relief in some cases, so they're valuable. And as I said before, they can actually help be a catalyst in your overall healing process. So, treatments. I believe any of you could probably just come up with some treatments off the top of your head, such as massage, acupuncture. You can get into different types of massage, myofascial release. You can do decompression therapy, like, for example, inversion table or traction, mechanical traction in a physical therapy clinic. We've talked about all these things kind of recently. They can offer relief, heat, soaking in a hot tub, stuff like that. So these are all things that can help you feel better. And yeah, I don't think they're bad things. I just don't think that should be the main focus for the long-term problem. And so that brings me to stretching. Stretching is something that may or may not be helpful in the long term, and that's why there's a question mark here. Stretching definitely can offer relief. The muscles are tight, so it makes sense to stretch them, to lengthen them. And as we all know, you can get into the cycle of stretching where they just tighten right back up, and you stretch, and they tighten, and you stretch, and you live your days in that cycle. And potentially, you could just go on living like that. But part of me thinks that there is a contributing factor of stretching actually maybe even worsening the problem a little bit. So, for example, when you stretch a muscle, you are actually on a micro level, if you stretch it deep enough, you're creating little micro tears in the muscle. And that's what stretching is. If you get actual long-term benefits to your stretching, then you're changing the structure of the muscle. You're making micro tears in the muscle. When it heals, it forms more cells and structures itself in a lengthened state. But that's only effective in some cases. And in other cases, those micro tears may just be contracting back up, and the muscle, as we know, tightens back up, and it may not be beneficial in the long term. So I have a question mark there because I don't have a full clarity on it. Excuse me, one moment. But I do want to comment on something like a forward fold. So if you know what a forward fold is, like in yoga, where you actually just completely hang on, it's like touching your toes, but you completely let go, and you're hanging on your lower back muscles, and you're folded in half, and you just, you can grab your elbows and just like a dead weight hang in a folded position. That is something that I've actually personally used in the past, and I've had some, times when maybe I'm at a concert or in a situation where I don't have like a lot of resources, I can just go into a forward fold hang, and I've experienced short-term relaxation from that, and can help me get through an event like that. And I think there's something to be said about the forward fold, because it involves trusting your back. Now, when I was in my my low point of back pain, I would have never trusted my back to be able to hang on it like that. So I'm going to actually just get up and demonstrate just to make sure everybody is clear on what I'm talking about. So give me a second here. So we're just going to talk about something like this. And breathing. So something like that would actually have really scared me in the past, because I would have thought that is going to be hurting my back. And I grew up being told that, flexing your spine actually can be a bad thing. And over the years, having learned that flexing, forward flexion or forward bending of the spine is actually not necessarily a bad thing for the spine, and getting to the point where I could trust my back to just fully relax is, it kind of, I want to use the word traversed, but it's not. It crossed this threshold into what I was talking about with protection, and what we're going to talk about in a little bit with healing. The confidence and the trust that you put in your back to be able to do something like that, and to breathe, and to help send relaxation into it. It does have an effect. I think confidence in itself, and I think that belief are huge factors in the mindset component. Whereas the opposite would be fear. For example, I'm going to avoid something like that because I don't trust my back. And that fear in itself can lead to the protective cycle, the perceived sensation of needing to protect, whether or not it's actually true or not. So let's move on to the next thing. And I'm going to come back to this a little bit more, but ultimately stretching is a question mark, because I think it kind of depends on your mind and your mindset while you're doing it. So let's go on to relaxation. And I'm just going to check the chat real quick. Okay, so we do have a relevant comment from Tracy. So Tracy says, I had a PT who had me stretch my hip flexors constantly. It made them tighter and more painful, but he did help me get over my fear of forward bending. So Tracy, could you comment on that? What has been your experience with getting over your fear of forward bending? Have you noticed that you are able to forward bend without hurting yourself? And how has that been a positive experience, or has there been negative outcomes? I'd love to hear just you share for other people as well. Amanda says, this is kind of relevant as well. What do you think about having a really great deep tissue massage therapist working on releasing the tight muscles in the low back and hip while also working ourselves to correct muscle imbalance? So that's a great question. It's the combination of intervention, so treatments, which would fall under this short-term category here, right here, and also something that I would consider a long-term strategy, which is correcting muscle imbalances. So yes, that I would think is a great combination to, be addressing the root of the problem and also having a catalyst. If you have that opportunity to have the resource of a physical therapist working on your body, absolutely, Amanda, I think that's something it would give you an advantage over not having the physical therapist give you these relief methods. So yes. All right, so while we wait for Tracy to share her response, I'm going to talk a little bit about relaxation. So relaxation to me can involve something like as simple as breathing, meditation, sending your breath into the muscles, or just calming your mind. I think that can be a really powerful way and really challenging way to, in a indirect way, relax these muscles. And it does actually cross over into a more long-term strategy where this is something you can do right now, today. It's short-term action, but you can improve at this, you can get better at it, and it does address one of the root of the problems, which is protection. You need to be able to feel relaxed to feel safe, and your body doesn't necessarily need to feel like it's in protection mode if you feel safe. And so the art of being able to learn how to relax your body, like I said, is not easy. It's potentially one of the hardest skills to learn, but it's definitely a skill. And so there's breathing, and there are certain things that you can do to assist, like the pillow technique that I talked about 2 weeks ago. I'm not going to demonstrate it because there is a video in the program, the short-term relief method on laying on a pillow. It's also a YouTube video, and I went into the details of why it's effective 2 weeks ago on the stream. So laying on the pillow and breathing is probably one of the most the techniques that I use the most personally when I am in a pattern of my lower back muscles being chronically tight. So yeah, that's another technique. And then other ways to get your muscles to relax can be something like movement. For some people, movement like walking or certain types of movement can get those muscles to relax because of blood flow. So cardiovascular exercise, something where you can do a movement in a cardiovascular way where you're not overusing your back muscles. For different people, it's going to be a different activity, but you can get to the point where you can learn how to walk without overusing your back muscles, and that's part of the long-term strategy we're going to talk more about. But if it's not walking, if right now walking is something that tightens your back muscles, then maybe a different type of movement, maybe riding a bike, maybe swimming. So movement can relax the muscles because blood flow can oxygenate the muscles and make them feel better. So these are the short-term methods. If there are any questions about short-term methods, treatments, stretching, or relaxation, let me know. Just post in the chat, and I'm going to take a quick look in the chat, and then we'll go on to long-term strategies. So let's see. Did we get a response from Tracy? Yes. I used to never forward bend because I thought it would hurt me. Now I forward bend just to teach my brain that I'll be okay. I think it has helped with back tension a little. Cool. So the big thing about my big takeaway, Tracy, from your response is that the forward bend did not hurt you. And in the past, you said you would never forward bend because you were, actually, you didn't say that, but you did say you had a fear of forward bending. And so I'm assuming the fear was a fear of hurting yourself. And what you've discovered is that you can forward bend, and it doesn't seem like it's hurting you. You say it may even have helped a little bit. So that is I would call that a breakthrough. And I think that that does sink into your subconscious and your confidence in your back. And so I would encourage everyone, everyone has a different situation, and everybody's body is unique. So you got to feel for your own unique individual situation if you can forward bend. But the only way to know is to try. And if you have been avoiding that for many years or decades, like some people, it might be an interesting thing to give it a try and see how it feels, and then go from there. But it can lead to a breakthrough, and a mental confidence breakthrough can lead to healing. It can lead to the protective response not needing to be on as strong, which is part of the cause, a causal factor that we talked about. So let's take a look a little more into the chat. We got the response from Tracy. Cryotherapy. Jonathan asks about cryotherapy. Yeah, cryotherapy has many benefits. I believe it could potentially have a relaxation benefit, but that's not one of the benefits that is often talked about. At least in the moment, it doesn't seem to, but it does seem to release lots of healthy endorphins that would then later lead to relaxation after the cryotherapy. And so, yeah, 100%. I'm a huge fan of ice and heat, both. So, yeah, cryotherapy is basically cold therapy. Hello, Guillermo. And Jesse shares lots of forward folding in yoga for years. It feels really good, yet the chronic tightness is still there, so I'm suddenly afraid that yoga is maybe contributing. Confused. Okay, let's talk about that a little bit. So you've been doing your forward folds for a long time, so it doesn't seem like you've had a fear of it. It does feel good because tight muscles, stretching them, blood flow, oxygenation feels good. But we talked earlier about how potentially stretching, I have the question mark there because it does seem to just put you in this cycle where the muscles tighten right back up. And so maybe your causal factor, Amanda, I think it was Amanda that asked this, maybe not, was it Jesse? Maybe your causal factor was not so much the fear. Maybe it wasn't so much the fear, but maybe it's a pattern or a compensation, or potentially protection of an actual injury. So I think forward folds are potentially more able to address a fear factor and let people overcome this fear that they can't do that with their back. And then when they do it and can confidently come up and be like, wow, my back is strong enough to do that. And it can address that factor, but not necessarily, the other factors. So thank you for sharing that. Tracy, stretching in a forward bend doesn't help my back tension. Okay. Yes. It's interesting that you differentiated, Tracy, stretching versus like a forward fold hang, which also I agree is a very different thing. Okay, Guillermo, yeah, you have a comment that's a little off topic, so we'll come back to that. And then Kevin, for short-term relief, my PT has me forward lean and press hips over table to unweight the legs and decompress the lower back. I do this throughout the day. Okay, so forward lean, press hips over table to unweight the legs and decompress the lower back. Okay, I can imagine what you're doing. I don't think I can demonstrate because I have nothing behind me that can do that. But basically, you're doing a form of decompression and just unweighting your spine. So that helps. I would consider that a short-term method. So that's going to be under potentially treatments or stretching. And so it's going to offer you relief, but it's not necessarily going to be addressing the root of the problem, one of these three things. So let's talk about addressing the root of the problem, and we'll get into the long-term strategies. So the first thing that I want to talk about is how you really have two different things going on when you have a chronic back problem. In most cases, you have potential injury, you have injury or potential injury to the tissues. So maybe the discs are injured or degenerated or bulging, or maybe some other tissue in there is inflamed. Or it's just potential injury, or perceived injury, in which we talked about before. And those things need to heal. And the body needs to be able to heal the tissues by giving it time, and by also removing the factor, the cause that actually created the injury. And so that, and often, many cases, is posture and movement and stuff like that, or muscular imbalances. So you have the injury or the potential injury, and it needs to heal. But you also have the muscle imbalances, which in most cases are related to the cause of the injury, and you have to restore balance in your body. And these are almost two separate things that you have to address simultaneously, and both of them, to be able to get out of the cycle of pain. So with regards to healing, and I have the asterisk next to it because it is associated with protection. Okay, so not only do the back muscles tighten to protect an actual injury. So if we were able to heal that injury, the back muscles would not need to tighten to protect them. So the actual physical healing of the tissue, but also it may be more of a perceived injury that the back muscles are protecting. So healing would also cross over into the mindset. And this is where the confidence and the fear comes in. And so healing the tissues of the body is part of healing, but healing the thoughts and the state of the mind is also part of the healing. Because it is possible for tissues to heal, but fear to not go away from trauma or years of something like chronic back pain. And so I do believe the mind is something that needs to be addressed equally or more than the physical body in this entire process. And so healing could allow for the lower back muscles to let go and to feel safe, to not have to protect anymore. So this is associated with the protection factor. So how do you heal? Let's talk about how you can allow the tissues to heal. And if it's the mind that needs to heal, then that's actually going to be, that could be another profession that what I'm dealing with. But part of this restoring balance and developing healthy movement is going to involve confidence and trust in your body. And so that's going to be part of the healing process as well. So I feel like I need to take a quick breath here. Just reading this last chat from Patrick. Not many options for herniated disc other than surgery. I do disagree with that, Patrick. So let's talk about how restoring balance in your muscles, muscular balance in your body, can allow for a herniated disc to heal to some degree. Not that you can restore the disc back to the way it was originally, which I have an entire live stream and video on that, but the injured part of the disc that may be continuing to get injured through repetitive trauma can heal up, just like a cut on your skin, where the skin can heal up, but there may be scar tissue. There will probably be scar tissue on the disc, but it at least can actually heal to some degree. And if that can happen, then potentially the pain associated with that injury or potential injury can go away. So restoring muscular balance, in my biased opinion, is a huge factor in that. And so there's exercises you can do to restore muscular balance, such as the bridge is one of the most powerful exercises on the planet to, simultaneously address tight hip flexors and weak inhibited abdominals and glutes. So there are exercises you can do. One of my favorite go-to exercises for if my lower back muscles are in a chronic tightened state is the back anchor progression. And so we are, if you're in the program, you know what the back anchor progression is. It's day 3. It's in the free trial. So you can, by pressing your back anchor into the ground and pushing away from it, you're using all of your abdominal muscles to elevate your pelvis, or at least unweight your pelvis. So all of your abdominals are active, and in some cases your glutes as well, if you need a little help from your glutes to unweight your pelvis. And guess what is getting lengthened and relaxed by reciprocal inhibition in that process? It's your lower back muscles. So as a real practical thing you can do, something that I do, I talked about how I lay over the pillow and breathe. Another thing that I do is the back anchor progression, and I'll just hang out in that position for 5 minutes straight or longer and just breathe and just literally let my back kind of decompress as my lower back muscles are inhibited by this exercise. My abdominals are engaging in a healthy way. It's not like a sit-up or a crunch, which is not necessarily a functional, healthy way to engage the abdominals, but that gentle back anchor push away progression activates all the abdominals, a little bit of glutes, and you can do the marching and get a little movement in there and just spend a lot of time doing that. And not only are you getting a short-term relief through, relaxation of the lower back muscles, even maybe a real gentle stretch, not really, but very gentle, but you're also restoring balance in your body at the same time. And by doing the marching, you're training your body to be able to move in that state of abdominals are more active, lower back muscles are less active, and it's this process of restoring balance that is a long-term strategy. You can't change the sculpture of your body that is sculpted by muscle tone and muscle length overnight, or even in a period of a week. It takes months to change the makeup of the tissues of your body. They need to change shape and change tone and break out of patterns. So the exercises in the program are laid out in a way to help restore muscular balance. And at the same time, we're also learning how to move, which I think is the most challenging thing. I mentioned it briefly in the beginning when we talked about patterns. So just to associate, balance is going to associate with compensation, right? If you have muscular imbalances, then the lower back muscles typically are compensating for other muscles that are not doing their job, and movement is going to associate with pattern. So we need to develop a healthy movement pattern that can maintain the balance that we're striving for, that we're creating in our body. And so what's involved in a healthy movement pattern is confidence is a strong connection to the synergy of your body, not only certain muscles that you favor, but also all the muscles. And we can take a look at this picture here. So the abdominals, the glutes, it's not that we are trying to use only these muscles. They want to work, they should be working in synergy with the lower back muscles and the hip flexors. All of these muscles are good when they are working in synergy like this, but the predictable pattern is that certain ones are prone to becoming overactive, hypertonic, and other ones are prone to becoming inhibited and hypotonic. And so the movement is really the key element in being able to maintain and constantly communicate to your body how you want it to be. And so learning how to move with a healthy, subtle connection to certain muscles is how you can maintain that balance that you may have used exercises to achieve or to restore, which would then allow the tissues to heal. And so the healing can take place as the balance is restored, but the movement becomes key in maintaining the balance, and also it requires healing as well. It requires that you feel confident in your body, that you trust your back, and that you've developed a healthy connection. You've developed a healthy core connection. And so this is the hodgepodge of all the factors that I believe it takes to get those back muscles to let go for whatever reasons that they are holding in that chronically tightened state. So, and there are more short-term relief methods that we could talk about. There's a ton, and some of them are more effective than others. But the focus of the program is typically not on these things, because so many other programs and treatments and healthcare modalities are in this category. And so those are always available to you to do simultaneously with the strategy of the program, the healthy movement and the restoring muscular balance, and identifying that healing your body requires these things to happen. And also it is not just a physical thing, but it's also a mental component. It's a mindset thing too. Let's take a quick look into the chat, see if there are any questions coming through. And hopefully this has been very long-winded, but hopefully it's been helpful to somebody. So Tracy, this conversation is fascinating. I believe part of my pain has been made worse from a bad stress reaction from corticosteroids. That's very possible. What happens in the mind definitely affects the body and vice versa. Have you heard of NeuroMD? It's electrical muscle building stimulation, not TENS, put on the lower back. What are your thoughts on this? Could it make the muscle imbalance worse? I don't know the company NeuroMD, but I am familiar, Tracy, with the different types of electrical stimulation. So TENS is just one very specific type, which is only for pain distraction. It distracts the pain for 2 to 6 hours, and it does really nothing else. It scrambles the communication from the nerves to the brain. But yeah, there are other electrical stimulation techniques that are for muscle building, which I'm familiar with, and they are used commonly in physical therapy for stroke rehab and stuff like that. So I'm assuming NeuroMD is something similar. And I don't necessarily think that the lower back muscles need to be strengthened or built up. I think that what's going on with the lower back muscles is typically that they're overworked, and so working them more is not the solution through a device like that. And ultimately, any external device that you put on your body is going to fall into the short-term category because it is a treatment, and it does not involve you learning neuromuscular re-education of your mind-body connection, how to use your body in a healthier way. That, to me, is the only long-term solution, is how do you operate this thing that we live in better? And usually an external device or somebody else putting their hands on you isn't the best medium for you learning how to operate the body. Now, it can be helpful if you have a good therapist that knows how to give you cues, tactile cues. Okay, move here. Okay, use this. That can help. But ultimately, it does have to be applied outside of the clinic. You have to leave the clinic and continue to practice it over a long period of time because these changes need to be grooved into your patterns. That's kind of my general opinion on devices like that. And that looks like I'm pretty caught up in the chat, but I remember there was a question from earlier on that I said I would get back to, so why don't we get back to it? We'll see if that person is still here. Amanda, M Sculpt, to give a little extra help in strengthening the deep abdominal and glute muscles. So I'm going to go ahead, Amanda, if you're still here or not, and assume that M Sculpt is another company that is the same as or similar to NeuroMD, where they offer an electrical stimulation of the muscles. And I would say that in the same way, as the same answer as that I gave to Tracy, that it's going to fall into the short-term category. But the interesting thing about your question was that you were wanting to use it for the abdominal muscles. And so in a weird way, it could help to activate the abdominals and help you just get more familiar with the, get more familiar with them being awake and using them. So it could be a kind of just a jumping off point to use something like that to just activate them. But ultimately, you're going to have to learn how to use those muscles in your daily life on your own without the M Sculpt machine. So that's my thoughts on that. And then there was a comment from Guillermo. Oh, you were just kind of sharing that you're able to do 1 minute holds of the bridge now. That's awesome to hear, Guillermo. Thank you for sharing. So I think I'm caught up with the chat. Just let me know if I missed anything. And I know Sipora, you mentioned you are wondering about neutral spine in Pilates. So neutral spine is a concept in not just Pilates, but pretty much, hopefully it's a concept in all movement practices, and neutral spine it's a feeling. Yes, it is a biomechanical position that is between the two end ranges of motion of forward bending or backward bending, or you could call it anterior pelvic tilt and posterior pelvic tilt. It's in the middle of those two places, but you really can't use something like a visual cue, like a mirror or someone telling you to change your spine position to find neutral spine in order to learn neutral spine. I mean, you can use it in the beginning, but ultimately you have to learn how to feel neutral spine, and that's the hardest part. You got to be able to know where you're at based on feeling your body. And you can apply that to Pilates. My personal opinion on Pilates is that it's heavy on the hip flexors. And so if you do Pilates, you'll want to counterbalance that, or hopefully you have a good teacher that incorporates, like a lot of bridging into the class and counterbalances all the heavy hip flexor work that is happening in a typical Pilates class. And the goal is to maintain neutral spine throughout that process. Amanda, 20,000 sit-ups or squats. Yeah, that would be an awesome jump start. So there's a lot of healing in the process of doing 20,000 sit-ups or squats. So what you would want to know about doing 20,000 sit-ups or squats is you don't actually get the benefit from the activity of doing the sit-ups or squats. The benefit comes later after you are done doing those activities and you've broken down your muscles, and then your body heals up stronger than it was before. And if you were to do 20,000 sit-ups or squats, you would be breaking down your muscles severely. I think it would be, there's a reason why we can't actually do that many of those activities, because they would be broken down in maybe a detrimental way. There's certain thresholds that your body doesn't let you cross. So you get something like, muscle burn, like lactic acid buildup that says, okay, after 100 squats or however many, like, I'm not going to let you do anymore because you're going to hurt yourself. And then over the next 2 to 3 days, you heal up stronger and your muscles get stronger. So it doesn't make a whole lot of sense that they would be doing the equivalent of 20,000 of those things, because that would be a lot of breakdown, and the benefit actually doesn't come from the actual movement. It comes from the healing of the breakdown. Okay, Cipora says, it's just the idea of neutral spine was me arching my lower back, whereas your program has me anchoring my lower ribs, and there isn't that space behind the lower back they seem to want. Ultimately, Cipora, I would suggest that you got to go by what your body's communicating to you. So if what they're saying to arch your back feels good and feels better, and after the class you feel better, and that night and the next day you feel better, then maybe that's what's best for you. Or if doing anchoring, and I do want to differentiate, anchoring your back anchor, the bottom of your rib cage, is not the same thing as flattening your lower back or smashing your lower back into the floor or posterior pelvic tilting. Though that it may decrease the space of the lumbar spine and the floor, but you just let the lower back go for the ride. We're not trying to control what the lower back does. So if that feels better for you, then you got to go with that. But ultimately, your body is the deciding factor in what works best for you, and then that's what you should pursue further and do more of what's working for you. So we've been going for an hour, and I have a bunch of student questions to get through. So I'm going to switch gears and go into that. Before I do, we're going to announce the Student Hub Student of the Week, who is Kevin. And I thought we had a last name. I thought actually he might have been here today. Not sure. But you know who you are, Kevin. You've been participating, and your one of your posts is here. So it says, you say, I've been expounding the virtues of the CBT program to anyone who will listen, including physical therapists, doctors, and friends. Doing so has helped me understand the program better when trying to explain the nuances to others. And so this was the really, the thing that we really appreciated hearing from you, Kevin, and potentially the winning factor in getting the Student of the Week. We've talked a little bit about how teaching is the best way to learn, and I'm not I'm not the first person to say that. That's a widely agreed upon kind of practice is if you want to learn something in the best way, teach others. And so, Kevin, you have actually done that, and you're experiencing the benefits. So you say, I've enjoyed all the Student Hub posts, daily lesson comments, FAQs, and YouTube videos. So much great information, insight. So just thank you, Kevin, for sharing. Thank you for telling others about core balance training and for teaching others. We're happy to hear that you have learned from that experience, and just hope that it encourages other students to do the same. So congratulations. You're the Student Hub Student of the Week. We're going to add a month to your membership. You have to do nothing. We will just add the free month for you, and keep doing what you're doing. We appreciate you. Kevin, you are here. All right. Good to see you. I love when the Student Hub Student of the Week is here live. And so congratulations to you. Madeline, why don't doctors understand this? I believe that the big disadvantage that some doctors have is that they haven't actually experienced it. And so I would imagine that some doctors do understand this and some don't. But there's only so much that a classroom can teach, and even clinical experience. So when you feel the feelings of what you're teaching or addressing, it just gives you so much more insight into teaching that. So for me personally, I've been through the ringer with back pain for over a decade, and so it's really helped me to be able to understand other people's issues that are going through the same thing that I went through. So let's get into the questions, and you are very welcome, Kevin. And let's see. Here we are. David Swager says, my back pain is in the L3 through S1 range, specifically L4 to L5 due to disc degeneration. In the past, I've experienced pain relief by wearing ankle weights while walking the dogs. Is this a useful exercise to continue? That's a great question, David. I'm going to have to go with my one of my go-to responses is it's not necessarily about what you're doing, it's more about how you're doing it. And so if you were walking in a healthy way, adding ankle weights would maybe add a little more, intensity to that and maybe give you more benefits. But if you're walking in an unhealthy way, then it potentially could compound the negative effects of walking. And so it sounds like in the past you have gotten benefit from it, and for whatever reason it's been helpful to you. It doesn't make a whole lot of sense to me from a biomechanical standpoint why that would work. I'll be honest. But one of the rules that I like to promote people to follow in the program is do more of what's working and less of what's hurting. So if that's been helpful to you and you don't think it has like a longer term negative consequence, like for example, if it feels good in the moment, but later that night you don't feel so good, as long as that's not the case, then I would say, why not? You can continue to do that. And hopefully, it can help you to build on the stuff that you're doing in the program, which is more of a long-term, a more lasting solution. And this, for whatever reason, is helping you feel good along the way. So yeah, thanks for sharing, David. Let's go to the next one from Randy. I feel my core is getting strong, but my back is not. It feels weak. Any suggestions? So that's a good question, Randy. I think potentially when our back feels weak, there could be two reasons. One, the obvious, it may actually be weak. and the muscles could potentially be weak because maybe you've been avoiding using them for a certain period of time, maybe a really long time. And when we don't use it, we lose it, right? So the muscles in the back could have become a little bit weak. Or the other possibility is that the muscles aren't necessarily weak, they're just tired. And I think this is a really common experience for people who have the topic of the stream, chronic lower back muscle tightness and tension. Those muscles are overworked, working all day long, doing too much, overcompensating for other muscle groups, and they're tired, they're exhausted. And so at certain times of the day, potentially maybe more like the end of the day, that your back feels really weak, but it's more like those muscles are just running out of steam. And so if that's the case, if it's like at the end of the day, then it's probably the latter possibility. But if they feel weak no matter what time of day it is, then it might be the former, which is they actually are just weak. The movements in the program are full body, so I'm not sure at what point in the program you're at, but I would suggest that the bridge does engage the back muscles, and then the core is, when I talk about the core, I am talking about 360 degrees around. So if you're doing an exercise like bird dog, like the front anchors challenge, that should be working your back muscles too. That should require your back muscles to stay stable and be able to move your limbs and maintain a stable core. So I would suggest that you go through the program as it is designed, because it's just modeled after the way we naturally developed movement. And if your back muscles feel weak, then you can add a little emphasis to strengthening them throughout the exercises that you're doing. So as I mentioned earlier in a different response, it doesn't really matter what you're doing, it matters how you do it. And so you can do a squat or any movement and engage your back muscles more while doing it or less while doing it. And it depends on what your goal is. It also depends on the actual situation, which is what I was talking about earlier. Are they actually weak, or are they just tired from being overworked? So you got to answer that question first. And then the suggestion is, I'd say go through the program and modify what you're doing to use any movement. So we eventually get up off the ground and we're doing full body movements to use those movements to strengthen your back muscles. And that'll just be with how you're doing the exercise, how you're feeling your body while doing those movements. So hopefully that helps. I don't necessarily recommend back-specific strengthening exercises like, what do you call those? Roman chair back extensions and stuff like that. And typically those aren't going to be the solution for people. So if that's the kind of question you're asking, it's not a typical thing I recommend for people. So, all right, Elliot, I'm glad to see you made it. So Taylor has a question. After my latest setback, I watched the setback YouTube video and found some relief laying on my stomach with a pillow under my hips. I was curious if I should continue to do this daily, even after my nerve pain has subsided, and I've begun my back anchor practice again. Or should I stop and only return if I experience another setback? Great question, Taylor. This is a really great question. I would say that there is a buffer you want to create. So you don't want to ever, with any injury, especially chronic, just get to the point of relief where you have gotten to the point of no pain and then stop doing the things that helped you get there. You want to go past the point of no pain and create yourself a buffer of where you can go out and do something fun and crazy and maybe be hard on your body and not get pushed back over that line of into pain. And so keep doing the things that helped you get pain-free beyond breaking that threshold. And I want to say, hey, congratulations on getting out of, you said nerve pain. So That's a huge milestone, and I'd say keep doing it for at least a little while longer. Maybe it's helping to relax your lower back muscles that were contributing to the nerve compression. And so we always want to keep our focus on the root of the problem. The nerve compression was the result of the problem, but maybe that root that caused the nerve compression is still going on a little bit. So you want to keep treating that as the primary focus. So hopefully that helps, and that would be just a general rule for anything that you're doing. If it's working, do more of it. So great question. Moving on to Elaine. Progression has slowed down for me as balance issues are a stumbling block. Standing on one leg, I wobble and start to fall over. It feels like my ankles are the weak spot. Okay, so yeah, there are certain tools you can use. I forgot to bring like a cane in here, but you can hold on to a piece of furniture while doing the single leg stance. I do a lot of balance training in my clinic work. So we progress balance by, say you were holding on to a countertop. Say you're doing core balance training in your kitchen and you're doing a single leg stancing exercise and you're holding on to the countertop. You can't see my desk, but it's right here. And you're holding on and doing the single leg balance and you're like, okay, I got this. Like I got my balance. Well, the next progression might be 2 fingers, holding on with only 2 fingers. And then the next progression might be only 1 finger holding on to that countertop. So you're a little more unstable, but you got it. So you got to find that level of progression that's most appropriate for you at your current stage of balance, skill level, and challenge it there where there is a challenge, but you are able to maintain balance. So in the beginning, that might be a full hand grip on a solid surface like a wall or a countertop or the back of a couch or chair or a cane. But as you want to start progressing towards less support. So, for some people, when I'm working with somebody with a stroke, it's 2-hand support, and then we move to 1-hand support. But then you would progress to 2 fingers, 1 finger, no support, and just have it nearby. Have that wall or that countertop nearby just in case. It gives you that mental safety net that can give you the confidence to push through it, where if you didn't have that, that fear might wobble you over. So that's the suggestion, is any of those single leg, you gotta build your single leg balance, regardless of who you are, regardless of being in core balance training. The number one predictive factor in falls in the elderly is certain balance tests that involve single leg balance. If you can maintain single leg balance, you are not going to have a problem with falling and balance later in life. So good to start now, start early, and be able to maintain standing on one leg as you get older. And so that is a goal in itself. And the core balance training stuff that we are doing are layers on top of being able to keep that balance as well. So hopefully that helps, Elaine. Next one is Kevin. This is Kevin, the student hub of the week. So you're here live. Hopefully my stream's still working and everything. So Kevin, you say, while doing the bridge, my left foot lies flat on the ground while my right heel is my contact point and my right foot is about 12 inches in front of my left foot. Oh, okay. My left knee bends 90 degrees while my right knee bends only 45 degrees. In this position, I can only raise my butt about 1 inch. I do feel my connections, but don't feel the same engagement of my left and right sides of my body equally because of the awkward positioning of my feet. Do you have any suggestions on how to get closer to the perfect bridge given my limitations? If you're still here and able to chat, Kevin, let me know, because I could potentially ask you some questions. For example, how long has this been going on with your right knee where you can only bend it to 45 degrees? Because that will affect my answer. But ultimately, you want to be able to get your knees to bend at least 90 degrees. That would be the absolute minimum. And you can improve the knee range of motion through therapeutic interventions. This is something I do in the clinic with patients as well. If you get a knee replacement, you don't necessarily get all your range of motion back. That's why physical therapy is actually quite important for joint replacements, to make sure you get that range of motion back. And so there are certain manual techniques we can use to improve the range of motion if it's joint restrictions, or if it's muscular restrictions, where in the knee, I don't think a muscular restriction would keep you to 45 degrees. But who knows? Yeah, and there's stuff we can do with that too. So you had 2 knee replacements in 2020, and one knee had a better outcome than the other. And it's been 2.5 years, because we're now in the winter of 2023. And so 2.5 years. It's not 10 years. So see if you can gain some more range of motion. That's going to be, a huge factor in your life, not only with doing the bridge, but going up and down the stairs, getting in and out of a car. And as you probably already know, I'm preaching to the choir here, but for other people who might be listening, you want to get at least 90 degrees bend in your knee, and they say functional is actually 120 degrees, so you want to be able to get more than that. And you've gone to 5 PTs. Okay. And are the PTs at a loss? Are they inexperienced, or are you set? Everybody's concluded that you are the way that you're going to be, and this is the finished product with knee range of motion, particularly. Sipora, yeah, I can talk about knees over toes guy, for sure. Yeah, his stuff is actually in alignment with my stuff in many ways. He takes a different approach to rehab and healing, but just in the belief of what the body is capable of, and also in kind of questioning general accepted beliefs. The general consensus on certain things. He goes against the grain, so I respect that. Oh, still trying to figure it out. Okay, Kevin. So, where do you live? And if you live somewhere with access to lots of healthcare professionals, it might just be a matter of finding like a really good PT. If you lived near me, I would recommend somebody to you. But yeah, if you live in a very rural place and you've seen all 5 PTs within 100 miles, then there's a different story. Maine, okay. So it's probably limited access in Maine, I'm just going to guess. See if you can find a good one, a manual. What you want to search, like the internet or ask around, is for a manual therapist. Okay, good with his hands, and they will do joint manipulation. And he might have to cause you some pain, but the titanium joints are, as long as they are fused to your bone, they can handle the manipulation. It may take a little bit of force, but you got to break through and get to more 45 degrees. Notice I haven't even answered your question about the bridge. I think that if I were in this situation, I wouldn't be using the bridge as a way to address the knee problem, and I would just modify the bridge, and I would potentially put your right ankle up on like like a stool or a exercise ball that will just, so your leg is more or less straight. So you have your left knee bent in the 90 degree position, and the right knee is straight, and it's propped up on a little exercise ball or something that keeps your thighs level. So the main thing would be that your left and right thigh above your knee are level. And so the one is straight and one is bent at the knee, but you're generally the same height with your thigh, and then bridge that way. And you can try and potentially get the most even amount of muscle activity on both sides. You'll just have a little more, it'll affect your hamstrings differently on the right, and you're not going to get that same stretch in your right side of your right quad muscle, rectus femoris. So, cool. So let me get to your next question, Kevin. So this says, alternatively, if I put myself into 90-90 position with feet against the wall or with legs bent over a coffee table, I'm able to raise my butt about 4 inches. Compensating positions, of course, use different muscles, probably not lengthening hip flexors, but I feel core connection. This feels comfortable for my lower back, and I'm slowly building endurance. Any suggestions of comments for this compensation? Well, my first observation is that you put 90-90 here. So does that mean, Kevin, that you're able to get into 90-90 with your right knee when you're up against the wall like this? And it's not unheard of that that different positions allow for different knee ranges of motion. So if that's the case, then yeah, this might be an advantage. And then the other question is, how does your neck do with this position? Because if you're up against a wall, you're going to just have a lot more pressure on your neck doing bridging like that. And so if your neck is okay, if you have a good healthy neck, then you got no problem with it. You can feel the core connection. You're getting the glute strengthening. You're able to. You're not getting the hip flexor stretch in either modification, so that's okay. But you're still getting tons of benefits by getting the muscles that bridge you up stronger, and eventually you can build up to bridging into your hip flexors and getting that lengthening of those muscles. So I love that you are being creative. I think you're doing the right thing. Ultimately, you want to feel your body, and if it feels good, and you want to consider the long-term feeling, so later in the day and that evening, still feeling good, then you can keep going with that particular modification. So yeah, I like that you've tried up against the wall. Let me know if you have any more questions, follow-up questions in the chat, Kevin, and I'm going to move on to the last question of the day from Luke. And Luke says, I was watching a YouTube live and you answered to someone about sitting and the sit bones that it's more based on gravity and pushing down into them. I have some questions. All right, so 3 questions here. Does my back hurt while sitting because my muscles aren't used to being in certain positions and they are getting turned on now with the core engagements, so the muscles aren't used to being like this? I actually can't answer that because there is a possibility, but I can't say for sure because I just don't know your body. I can speak from my own personal experience that my back hurts when I sit too much because my discs, actually, the degeneration in my discs don't like the sitting position. The sitting position, we can review. I did a stream on sitting where we talked about the different pressure on your discs in different positions, and sitting position is actually the most pressure on your disc. And so if you have disc degeneration, it's just, they don't really, that kind of situation doesn't like sitting. That's for me. And so it may be that your back muscles are tightening up to protect those degenerated discs or something else that's going on. So yeah, it's possible, but I wouldn't say that it's not that it doesn't make sense to me that they aren't used to being in the sitting position. I'm trying to infer from your question that maybe sitting in the push away makes your back hurt more. And I don't know that you're probably not here live, but it almost feels like you're saying that normal sitting is okay. It doesn't hurt as much as sitting with the push away because your back muscles are getting turned on with the core engagements. So that's possible. Yeah, you might be in the pattern of overusing your lower back muscles, and when you engage to do the push away, that they're just turning on even more, and they're getting that kind of chronic tension type pain, which is from a lack of blood flow and oxygen ultimately. So yeah, it's possible. Your second question: I have not been doing the push away sit bones properly, and maybe putting too much pressure on just trying to figure it out, and just putting my back in an uncomfortable tension position where it hurts constantly while sitting compared to just doing the gravity push down and the sit bones. Oh, it is a question. I just saw your question in the chat, Hans. I'll get to that in a minute. Have I not been doing the push away sit bones properly, and maybe putting too much pressure, just trying to figure out and putting my back into an uncomfortable tension position where it hurts constantly while sitting compared to just doing the gravity push down and the sit bones? Most likely, I think that the push away is one of the most challenging concepts for students to learn. It's kind of easy to learn with the back anchor because it's minimal moving parts, minimal factors. But in the sitting push away, there's so many moving parts, and it's so early in the program. But ultimately, it's a very low intensity thing. So I'm doing it to some degree. We'll call it 0.1%, and that's going to answer your question, Hans. Very low degree for now an hour and a half, right? I've been doing some degree of the push away because it's just ingrained into my pattern. And so if I were doing that at, say, 10% effort, or maybe what you're doing in the early stages is 50% effort, then I would not be able to last for an hour and a half, and my muscles engaging at 50% would get extremely tired after a couple minutes. And when muscles get tired, they get painful because they are not getting the blood flow and the oxygen that they need to breathe. And so that could be a factor. And so I went full screen to try and demonstrate that what's happening is I'm accepting gravity into my body, whereas in the past I may have tried to fight gravity and try and lift up and have good posture. But actually what I've learned to do is accept the gravity and allow the gravity to pull me down, and everything comes down, and I can feel the weight go into my sit bones. And it's a very subtle process. And then I can actually just gently push. I'm pushing down further. But actually what's happening is I'm getting taller because of ground reaction force. So gravity is recycling back up through my body. And you only need to do this at a 1 or 2% level to actually feel even movement. The amount of effort is extremely important with this, and you want to be able to initially just feel it, so it might take more effort, but as you implement it into your daily life, you can actually drastically and gradually reduce the intensity down to a manageable level that you can have the endurance to continue throughout your day. So let's get to your third part of your question, and hopefully that answers your question, Hans. I do not sit in a normal chair. That's just a plyo box with I don't know what you call it. It's like a floor mat or something. It's just a cushion on top of a box. I'm sitting on a box. Yeah, that's how I sit. I have a whole video and live stream on sitting, where I go through all my sitting setup, Hans. So if you go to the Core Balance Training channel, you can find that and see all my different ways of sitting. So question number 3 from you, Luke, was with the gravity and push down, would that apply as well during standing and pushing down into the heels and feeling it go through the whole body down into the ground with the heels? That's a good question. I'm just going to read the last part of what you wrote before I answer it. Would love to hear more about this gravity and push down, as I feel sitting and standing really bothers me, and I think I may be doing something wrong or just overthinking too much and putting more tension in areas. Yeah, overthinking is probably one of the most highly consistent things among students, is that we're trying to kind of understand this process from a logical perspective, but actually what's happening is we're just modeling after the way an infant and a baby developed, and an infant and a baby did not understand any of this. All they had was gravity. They had the floor that they're laying on, and they have the desire, the intention, which is what we talk about a lot in the program. The intention of theirs is to get up off the floor and be like everyone else. So it's really that simple, and they're interacting with gravity and the floor. So how do they do that? They push away from the floor. And so we're trying to model that, and we're learning how to simplify all this science that has become overcomplicated through modern human science and technology is brilliant. But when we're trying to relearn something like movement, it may not be able to reproduce the way that we naturally were supposed to move. It gets overcomplicated and we overthink things. So to really just simplify it into what I said, the example with the baby, and it really is that simple, and just gently have the desire to push away. And then when you apply this to standing, it's not as simple as that. And we get into standing, I'm going to guess, Luke, that you're not yet into week 5 of the program, because we apply the push away to standing, and you're actually, there's more factors than just straight down into the ground. So I'll just kind of stand up here, and I know I'm full screen here, so you can't capture my whole body here, but when we're standing, we have God, I gotta show a slide real quick. Hold on. When we're standing, we're dealing with forces that are trying to fold us into this poor posture position. And so when we're doing the push away, we're pushing away from upper front anchor, back anchor, and lower front anchor in standing to achieve more of a straight line. And so it's not as simple as pushing down into your heels to get that accordion to straighten out. So that's kind of the point I'm trying to make, is I'm not just pushing down into the ground when I'm standing. I'm actually pushing away from my upper front anchor, my pubic bone anchor, and my back anchor, and that's kind of taking me from, posture to predictable pattern posture of forward head, rounded shoulders, and opens me up. And so I'm actually pushing away from the areas that we are learning in week 1 and week 2 of the program, module 1 and module 2. So that's the push away in standing. It's a little more complicated, and hopefully that makes sense to you, but you'll get there. The best thing you can do right now, Luke, is to just master to the best of your ability what we're learning now. These are the foundations, and then we're going to add the layers as they are appropriate to apply them to standing and functional movements and daily life movements. So hopefully that gives you a little clarity, and that I answered your question as much as I could. So yeah, it's not necessarily through the heels. You want equal pressure throughout your foot. So you can imagine a triangle. You have your heel is 1/3, and then the ball of your foot under your big toe is 1/3, and then under your kind of like the outside area of your forefoot is the other third, like a tripod. So you don't want more pressure on the front or the back. It's kind of equal pressure for now. So anyway, that's the stream for today. We went for a little over an hour and a half. I appreciate everyone who still here and showed up live. And even if you're catching the replay, I'm trying to get back to where I can see you all. Still got a few people here. So thanks for being here. Hit that like button, support the stream so we can continue to produce this content and also help YouTube algorithm send our channel out to more people. So hitting the like button is one of the best things you can do for that, and also just share it with your friends and the people that you care about. If you know somebody that's in pain or has struggles with back pain, expose them to this kind of content and maybe it'll resonate with them. So that's all for today. Thank you everyone for being here, and continue to ask these great questions, and they inspire future live stream topics. So we love hearing from you, and until next week, get down on the floor and connect to your core. Take care, everyone. Goodbye.